It was the Chancellor's big idea to stimulate the economy.
Hello.
Eat Out to Help Out in August of 2020. Only he'd forgotten to tell the scientists about that big idea. At the COVID inquiry today, a witness statement from the now Prime Minister was shown.
I don't recall any concerns about the scheme being expressed during ministerial discussions, including those attended by the CMO and, no doubt, he means the GCSA. That's you.
The CMO is the Chief Medical Officer, Sir Chris Whitty, and the CSA, the Chief Scientific Advisor at the time, Sir Patrick Vallance. And it was his turn to give evidence to the inquiry today.
So I think it would have been very obvious to anyone that this was likely to cause inevitably would cause an increase in transmission risk. And I think that would have been known by ministers.
And Mr. Sunak?
If he was in the meetings, I can't recall which meetings he was in, but I'd be very surprised if any minister didn't understand that these openings carried risk.
Sir Patrick was often by the Prime Minister's side, along with the CMO at the Downing Street briefings, but today he revealed the frustration he often felt during the pandemic. Sir Patrick's witness statements to the inquiry run to more than 200 pages, including diary entries. He said he kept these notes at the end of each day as a sort of a brain dump to clear his mind for the following day. What he probably hadn't expected was that they would become so public, but for us, they provide a frank exposé of what was going on in government at the time. In an extract from Sir Patrick's notebooks, he describes a long day of meetings on October the 25th and arguments for another lockdown. He writes, PM getting very frustrated, throwing papers down. PM then back on to, most people who die have reached their time anyway. Sir Patrick then quotes the former Downing Street advisor Dominic Cummings, who said, Rishi thinks just let people die and that's okay. This all feels like a complete lack of leadership. The following day, however, his diary entry records Mr. Johnson taking a different view and saying the COVID death toll was terrible. Mr. Sunak will give his own evidence to the inquiry next month. One section of today's hearing was dedicated just to Mr. Johnson and his understanding of science. 4th of May 2020, late afternoon meeting with the PM on schools. My God, this is complicated. Models will not provide the answer. PM is clearly bamboozled. June 2020, watching the PM get his head around stats is awful. He finds relative and absolute risk almost impossible to understand. September 2020, Claire Gardner talked PM through the graphs. It is difficult. He asks questions like, which line is the dark red line? Is he colourblind? Then, so you think positivity has gone up overnight? Then, oh God, bloody hell. But it is all the same stuff he was shown 6 hours ago.
The Prime Minister at the time gave up science when he was 15. And I think he'd be the first to admit it wasn't his forte and that he did struggle with some of the concepts and we did need to repeat them often.
This inquiry's module on political decision-making has raised many questions over the government's handling of the pandemic. Even today, Sir Patrick said the former Health Secretary, Matt Hancock, had said things that were not true. But each minister will get their time on the stand, with Boris Johnson and Mr Hancock also due before the inquiry next month, when they will no doubt be asked about how well they thought they handled the pandemic.
Victoria McDonald reporting there. Well, earlier I spoke to Jean Adamson from COVID Families for Justice. Her father Aldrich died with the virus in April 2020. I started by asking her what she made of today's evidence.
Today has delivered devastating news, more devastating news for me personally. And I'm sure I speak for many of the bereaved families as well around the nation. To hear now that the government knew, and in particular Rishi Sunak at the time, knew that by introducing the Eat Out to Help Out scheme, that infections would increase I think is really very, it's very hurtful. It's very disappointing. It almost feels as if, you know, we've placed our trust in him and in the government to do the best to protect us, to keep us safe. But we've been very badly let down because they knew all along.
Sir Patrick, when he talked about the risk of transmission connected to Eat Out to Help Out, talking about almost the inevitability of it, Rishi Sunak, now Prime Minister, of course, says in his statement he didn't recall any concerns about the scheme being raised at ministerial discussions. What did you make of that? Well,
that's disingenuous, isn't it? In light of what we've heard today, because what Patrick Vallance has told us is that they weren't consulted. The scientists were not consulted about this policy decision, Eat Out to Help Out. Clearly, you know, the government's mantra of, we were following the science, very clearly is not the case. They followed the science when it suited them, when it fit their own agenda.
I mean, there have been many striking moments in today's evidence. The Chief Scientific Advisor spoke about how the Prime Minister seemed bamboozled by science and how the Health Secretary, Matt Hancock, at the time, often said things that weren't true. What do you feel about that bit of the evidence?
It's breathtaking, the level of incompetence. Now, here we have the Prime Minister. He clearly didn't get it. That's very worrying.
And any sympathy at all for the idea this was a pandemic we'd never seen before? You know, we were grappling with things that we just didn't really know enough about.
They had an opportunity to learn from the first wave. But what we now know is that the same mistakes were repeated in the second wave. And that's why we had a second wave. This inability to learn lessons, that's the piece that I find, just really sticks in my craw. You know, my compassion does not extend that far, I'm afraid, because they've clearly showed, you know, that they were prepared to treat the British public with contempt.
But just finally, you've spoken very powerfully before about seeing your father, having to look at him through glass in the last days before he died, him singing a hymn. I just wonder how hearing all of this impacts on that lasting memory that you have.
When I think about how my father died and, you know, the circumstances in which he died, and, you know, it didn't have to be that way. And I feel strongly that, you know, the government, they weren't acting in our interests.
Thank you so much for talking to us. Sorry to cut across you there, but thank you very much for talking to us this evening.
Thank you.